I think my mother knew that something had been going on for quite a while. She was diagnosed with stage 4 uterine cancer. She knew exactly what she wanted. She knew exactly how she wanted things done. And there was never any question in my mind, or either in any of the minds of our family, about how she wanted things to be done.
This is my 4th bout of cancer. I know my children would like me to live long as I can. For some of them, I'm the only grandparent the grandchildren have, but they don't want me to suffer.
I could see so much from my mom that she was trying to do the best for my aunt and really uphold what she wanted. My mom would tell me about her struggle or disagreements with my uncle. I can see that at the end of someone's life, how that kind of blood relation can be so powerful.
Hearing that you or a loved one may be nearing the end of life because of a serious illness or injury is very difficult. You may feel overwhelmed. You may not want to consider it at all, or you may have many questions about what will happen next. It may help you to know that there is a process you can use for making decisions and giving clear directions about your own medical care at the end of life. Medical orders for life-sustaining treatment. A medical order is a written instruction from a doctor to other healthcare providers about a patient's medical treatment. Medical orders for life-sustaining treatment, or MOLST, is a type of medical order used to give instructions about end-of-life medical treatment for a patient of any age with a serious medical condition or injury from which he or she may not recover.
I went into critical care thinking that the goal was to try to save everybody. But I came to realize also after a few years that death is not a failure. Some people are simply overwhelmed with disease and they are clearly going to die. Our job in that circumstance is to ensure they experience the best possible passing. When we do that, I feel the same satisfaction as if somebody was saved.
Patients might be struggling with confronting their own mortality, their own death, where they might be not fully understanding what all their options are and choices are, and perhaps there's conflict between the patient and the family, or confusion around medical options that somebody has in terms of meeting goals.
You go to many different scenes where you find somebody who is in or near cardiac arrest, and they're not able to communicate with you. There's no venue for them to do that. They're unresponsive or they're not breathing. And you have families standing by, especially in a hospice situation where family would have congregated around that patient, and you have one child saying, she doesn't want you to touch her, you know, just leave her alone. We just didn't know what to do. We called 911. And you have another child saying, no, that's my mom. You need to save her life. You need to do everything you can. And there's no paperwork. There's nothing. There's no venue for that patient to be able to communicate to you what they want.
Mi hermano había hecho una decisión de que si algún día él moría, que no le pusieran ninguna máquina. Sobre esa decisión no se la respetaron. Y entonces por esa razón es que ella nos pusimos de acuerdo que si algún día ella le pasa algo, ella me dijo a mí que ella no quiere que nadie le pase por encima de eso. Es lo que ella diga y lo que yo diga.
When a person's heart or breathing stops, health professionals are required to attempt treatment to restart it, unless they have written orders from a doctor with other instructions. Such life-sustaining treatment can include mouth-to-mouth breathing, forceful pressure or electric shock to the chest, and intubation and ventilation, putting a tube down the throat and attaching it to a breathing machine.
The portability of MOLST is just an incredible plus because it means that nothing gets lost. And people move all the time. People who are sick, people who have chronic illness at the end of life are in and out of hospitals, from hospital to rehab to assisted living, hospital, rehab, nursing home, assisted living, back and forth. If you got something that goes with them that everybody knows about, it's going to make for great care. It means nothing gets lost, because that happens. You know, a person collapses at home, they've already got a DNR, they had DNR in the hospital. Of course, the EMTs don't know that. They respond, the person's out, nobody knows what's going on. They resuscitate the patient, they intubate them in the hospital. Families come in, well, he didn't want that. Well, yeah, but who knew?
The process of using a MOLST form lets you talk through your questions and choices with your doctor and turn your decisions about medical treatment into written orders that will be honored by health providers wherever you need care. The MOLST form contains your choices about whether you want to be given medical treatments that attempt to continue life, or whether you want to allow the natural process of dying to occur. The back of the MOLST form contains your preferences about certain other medical treatments that may be offered, and any other preferences about medical treatment that you want to express. Whether or not life-sustaining treatments are given, every patient at the end of life will be made as comfortable as possible. Completing a MOLST form is voluntary. You may decide to wait until another time to consider signing a MOLST form. You can also change your mind after your MOLST form is signed. If you do want to complete a MOLST form, the process begins with discussions between you, your loved ones, and your doctor about your current medical condition, the treatments you may be offered, and your goals for your medical care.
Discussions when somebody is capable of having some input and capable of making some decisions about what they want. And it's done with the family around, so the family understands that this is being made. And I think families feel a lot better about that and feel that some of the burden of making certain decisions is lifted because it was done by the patient himself or herself.
Discussions, this sharing of narrative is extremely important. So when it's not, when it's kept under a lid, when it's repressed, when it's denied, when it's shunned, I think those are worst-case scenarios. That doesn't mean that the outcome is necessarily any different than anyone else's, because we're all going to die. But, how rough and bumpy and emotionally wrenching is that experience for not only the person, but also the family that's involved. I think discussion helps.
I want to be at home. I do not want to be in a hospital, but I would like to have my mind working as long as possible. But I made a point to have discussions with all 4 of my children, so it's very important to me that they all are in agreement on following my wishes and my desires.
If a MOLST form is not completed, your preferences for treatment might not be known or may not be communicated when needed.
I think there are a lot of doctors that don't look at the person with a disability as they're able to make their own best medical decisions. And I know even when I go to medical appointments, if the doctor's new, they'll look at my aide or my boyfriend or my mother or whoever's with me and ask them questions about me. And a lot of people with disabilities get that. I trust my healthcare proxy completely. We've been together 19 years. He knows my wishes. He is a fighter. He's a go-getter.
A MOLST form is not the same as a healthcare proxy. A proxy is for everyone aged 18 and older. It names the person who can make healthcare decisions for you in the future if you lose the ability to make healthcare decisions yourself.
My thought is that with MOLST, it really shows what my choices are and how I want to do things without putting that burden on him to express it to other people and the medical field. I think it's a really tough decision and position to be in to fight with family members, friends, medical staff, when they are my choices anyways.
A MOLST form goes into use right away. It contains specific instructions about medical treatment that are followed by healthcare professionals in any setting.
The most powerful benefit of the MOLST form is that at a time when an individual has greater clarity of thought, greater ability to reason through the difficult circumstances that they anticipate for themselves, they make decisions, they document those decisions, but those decisions are not then simply confined to one venue.
That MOLST form, if we start the care that the patient wants and we bring it into the hospital, we hand that MOLST form over to the doctor and they can continue the patient care exactly how the patient wants it.
You keep the MOLST form and put it somewhere in your home where it's easy to see. You carry the MOLST form with you in your purse or wallet outside of your home.
Nobody knows what that patient wants better than the patient who can't communicate to you. This MOLST form gives them that opportunity that nobody else has, and I think that being able to know what the patient wants is important because my values and their values can be very different. And what I think is right for that patient might not be what they want at all. So it would be very nice to have that simply stated because what I always want for my patients is what they want.
This is about not abandoning people when they're critically ill. This is about helping people understand this, for some people, most terrifying last journey. This is about helping families ease their own and the patient's suffering. This is the best we can give.
When the time comes that it's going to be very difficult and heart-wrenching and emotional and stressful and having to deal with so many other things, if that's already said and done and the decisions are made, I believe that it's easier for the loved one. See it as a final gift that you give to someone, that peace of mind.
Medical orders for life-sustaining treatment is a way to make known your preferences about medical care at the end of life. To learn more, talk with your doctor and find more information about MOLST at www.molst-ma.org.